So what we're doing with the SALUD protocol is we're giving back the identity, the health identity, to the patients, to the individual, the guy that goes to the hospital, gets their blood work done, whatever it is. So they control their identity. The second part is they actually also now control with their identity, with their keys. They also control their own data, their own health data. Now we're building it in a way that they don't even know that they're doing this.
Right.
Because if I'm a patient, I have
bigger things on your mind.
Exactly. I'm going to a hospital for other reasons, right? But the idea that I can actually control my own identity and control my own health data is a big thing, because right now, health data and health identities don't even belong to the hospitals. They actually belong to the software companies and the big data organizations.
Really?
Well, they don't belong, but they are the ones controlling it. So if I have this ability to say, okay, well, yes, here's my identity and here's my health data, and I can control that. And then the moment something happens and say crazy stuff happens in the world, and I say, you know what? I don't think I want you to have this anymore. So that I can from here on in say, I'm going to withdraw my health identity and my health data so that you don't know anything anymore. That ability doesn't exist right now because, again, it's all owned and managed over there. Single point of failure sort of stuff. Now what we're doing is we're actually taking that back, giving that ownership and that control of ownership back to the individual. So that means that if something happens, like I said, I can walk out the room, right, just like I did before with you and saying, I can hit you on the head, or I don't want like this. I can walk out the room. I can do that same thing in a digital way.
So it's like you just have the app and you just like switch off that hospital. Like, don't give them my data anymore. I'm done with those guys.
Exactly.
Yeah.
Or, yeah, exactly. That's the idea.
I have a bunch of questions. I don't want to get too into the weeds, but just a few questions, like especially about the transition. So I'm just imagining patients would just start over. So you don't have to transition from the cloud or the servers of people that are already there. You just kind of come in with a fresh identity. And then how would it work to bring over your current data that might be necessary for the doctors to have, for example?
Okay. So I would say that, when I go to a hospital, then there's all the standard stuff that I need to do. So I have
Fill out the form,
the forms, the blood tests and all that kind of stuff. Every single time I go to a hospital, I have to do blood tests, right? So because something new or a new blood test, whatever it is. So if I from here on in say, okay, well, now your blood test is done and
here it is.
Here it is. Say, by the way, download this app on your phone, and then you can actually manage your own blood test. That's a cool experience, right? So in other words, they just come in and say, okay, well, I've done my blood test, and instead of just disappearing into the ether, now the hospital can come back and say, hey, well, here's the blood test. You control it. It's on your phone. And there you go. So from a transition perspective, they just do their thing, go do their testing, and we just give them the tools to start managing this. And I mean, the idea that you actually say, come into a hospital, do a blood test, and 5 hours later, you say, ding on your phone, hey, your blood test has arrived. Here it is. And you control it. That's a cool idea, isn't it?
Pretty cool.
Yeah, exactly. And the other thing, I guess, is what we're trying to do is integrate into the existing medical world as well. So, for instance, the existing medical world has a lot of standards. I don't know if you heard of things like HL7 or FHIR standards, FHIR.
Oh, yeah.
Yeah. So these standards are standards of transmitting health information. So we're actually developing or have developed the way that we can actually transmit these Nostr messages or these Nostr transmissions, these health transmissions, using a existing medical standard.
Wow. That's cool.
It is, because it makes the transition from one to the other
Right.
very, very simple.
Right.
I got a question in regards to the problem that Nostr solves, or this implementation here. Like, have you heard of some horror stories of like medical information being misused, or kind of like what the downside is to centralized entity or a software company controlling your information? Has there been abuses already, or is this kind of like, looking out into the future and possibly seeing, like you said, the single point of failure, having control of your data and all the problems that can arise from that?
The way that it would work is as if I transmit a bunch of medical information through the Nostr protocol. As I said, I control the keys, and I can ensure that the whatever is transmitted with the Nostr protocol is not played with. I can't. No one else can control that, and only the person that actually can control the keys. And as a result, I can say that the information that is transmitted is verified 100% accurate. Right. So in other words, if I transmit a blood test or the results of a blood test using that FHIR sort of protocol, then I know that I've signed it, and the person on the other end knows that I've signed it as well, that information hasn't been tampered with, hasn't been played with whatsoever. If I use a existing sort of database technology type thing, like we said before, I don't control it. I don't own it. I don't do anything with it. So what that then means is that they do, which basically means that it can be manipulated by someone that I don't know anything about. That in itself is already a big difference. Okay. I think we as a society know that information gets manipulated. I mean,
Or bought and sold, and
correct. But let's just take, for instance, what's happening in Venezuela right now.
Mhm.
Is it real? Is it not real? These results, information gets manipulated. So in other words, if I actually am part of an existing world where I know information gets manipulated, we don't trust the information, and here through this protocol, I can guarantee that the information wasn't manipulated because it's been locked up with keys, right? That's a big difference already.
yeah.
So I don't know. It's up to you how much you believe information is manipulated or not manipulated. But if you then start to sort of think, okay, what does that mean? So the information that is out there right now probably has a certain level of error margin to it as well. So let's say it's 10%, let's say it's 20% error margin. Let's say it's 5, whatever it is. And now I also have this information transmitted through Nostr that is in essence 100% accurate because I can verify that. All of a sudden I have this information, say health information, say voting information, whatever it is, that is now 100% accurate, and I can say, okay, well, it's true. That one, not so much, or I actually don't really know, but this one is. So if I have all this health information out there swimming around in the whole wide world that is not even connected to an individual because I can hide my identity, but I can just have all this health information or whatever information swimming around in the world that I know is 100% verified accurate versus the existing information. What happens to the information itself? What happens to that data? How valuable is that? How unvaluable is that? So all of a sudden, I'm actually also creating a whole bunch of health data, a whole bunch of information that I know is true.
It has integrity.
Correct?
Yeah.
So is that valuable or not?
Yeah, absolutely.
Exactly.
It's like the don't trust, verify, right? It's like
Correct.
the same concept.